Welcome to your infection control induction training. My name's Charlene Liptrot and I am one of the infection prevention control nurses working at Warrington and Halton Teaching Hospitals, and I'm here today with Catherine Summers, who's also one of our infection prevention control nurses. Due to the COVID, we've had to change in the way that we would normally present to yourselves, so any feedback from the presentation you have received today would be great. You can either email us or contact us on 2117. So as you can see, the infection prevention control nurses, I've already mentioned, are contactable on 2117, and we're also on bleep 018.
Along with myself and Charlene, our team also consists of Leslie McKay, who's the Associate Chief Nurse for Infection Prevention and Control, Joanne Oldfield, who's our Surgical Site Infection Audit and Surveillance Nurse, and Amanda Millington, who is our Infection Control Secretary.
We have 3 microbiologists who are Zaman Kwazafi, Tung Chin and Janet Purcell, who are contactable with any queries in regards to antibiotics and anything like that really. So what is coronavirus and COVID-19? So the coronaviruses are a large family of viruses. They cause infections ranging from the common cold to severe acute respiratory syndrome, also known as SARS. The coronaviruses circulate between animals and humans. Sometimes new variants of the coronavirus emerges, such as our current COVID-19. COVID-19 has the potential to spread widely, as a lack of immunity means that everyone in the population is susceptible. Identifying suspected COVID-19 patients. So the patient has one of the following: either a clinical or radiological evidence of pneumonia, acute respiratory distress syndrome, influenza-like illness, so a fever more than 37.8 degrees and at least one of respiratory symptoms, or as if the patient's an inpatient, a new presentation of respiratory symptoms or a fever without any other causes. Symptoms included acute onset of persistent cough, hoarseness, nasal discharge, congestion, shortness of breath, sore throat, wheezing, sneezing, loss of taste or smell, and a temperature. COVID-19 is transmitted via exposure to respiratory droplets, so coughing, sneezing droplets onto mucous membranes. For this to happen, you need close contact. This is usually within 2 metres. Contact with respiratory secretions, so directly or via contaminated surfaces. Tissues contaminated with respiratory secretions and transferred by touching mucous membranes. COVID-19 is not transmitted in air except during a procedure involving the respiratory tract that generates aerosols. Our infection prevention and control strategies in regards to COVID-19 is isolation, so patient placement, following our cough etiquette, standard and respiratory precautions, and sampling for COVID-19. Isolation of the patient, so possible or confirmed cases of COVID-19 will take priority for isolation where access to side rooms is limited. If a single room is not available, patients should be placed in a cohorted area with other cases of COVID-19. Personal hygiene to prevent spread, so following the cough etiquette, the patient should be encouraged to cover their mouth and nose with a disposable tissue, dispose of tissues directly into a clinical waste bag, offering the patient's hand hygiene, so that obviously after coughing and sneezing or after contact with respiratory secretions or objects contaminated by these secretions. Ensure that the patients have hand wipes or alcohol gel available at the bedside, and following the Public Health England Government guidance of catch it, bin it, kill it. Standard precautions, essential to minimise risk of transmission between staff and patients. This will reduce the risk of transferring the virus from the patients not recognised to have COVID-19. Hand hygiene, protective clothing for contact within 2 metres of the patients. This involves wearing a plastic apron, a fluid-resistant surgical mask, gloves and eye protection, which is completed at an individual risk assessment level. Safe disposal of waste and clean environment and equipment. Hand hygiene, so immediately before touching a patient, before you complete a clean or aseptic procedure, immediately after touching the patient's surroundings, and after removal of gloves. Alcohol gel is effective against COVID-19 and soap and water should be used if the hands are soiled. So it's just following your WHO 5 moments of hand hygiene. Protective clothing should be worn for all patients at all times within 2 metres. This includes a fluid-resistant surgical mask, which is a type 2R, eye protection following an individual risk assessment, gloves, but these must be changed after every task you do as per WHO 5 moments and to protect our patients from infections, and an apron should be worn and changed if it becomes soiled and again in between your patients. Discard all protective clothing into an orange clinical waste bag and clean your hands. Remember to avoid touching your mouth, your nose and eyes throughout all these tasks.
So for any aerosol generating procedure, our precautions are as follows. This is for any patient undergoing an AGP, not just for COVID-19. So your gloves and your apron, so your gloves must be changed after each task as per the 5 moments to hand hygiene, and your apron should be worn over your gown, and you would change that if soiled. They must be changed between patients. Items of PPE that you can wear for an episode of care would include your FFP3 respirator mask, your eye protection and visor, and your waterproof long sleeve gown. All protective clothing should be discarded into an orange clinical waste bag and clean hands on leaving the area. Remember again to avoid touching your mouth, nose and eyes. FFP3 respirator masks, so these filter out very small airborne particles. They protect you from inhalation of fine airborne particles. Filtration is only effective if it's sealed and fits to the contour of your face, which does require you to be fit tested, and you are only to wear the mask that you have been fit tested for, and you need to perform a fit check before each use. Required procedures which generate aerosols of respiratory secretions, which are called AGPs, associated with high velocity air passing over respiratory mucosa and not required for other close contact. So our list of aerosol generating procedures, which we take from Public Health England, is any patients undergoing intubation and extubation, manual ventilation and open suctioning, tracheostomy care, high flow nasal oxygen, induction of sputum with saline, non-invasive ventilation, so that will be patients on our BiPAP and CPAP machines, and high frequency oscillating ventilation, upper GI endoscopy and open suction of respiratory tract, bronchoscopy and ENT with suctioning, surgery and post-mortem procedures that involve high-speed devices, and dental procedures which involve high-speed drilling. So when to use a surgical face mask or an FFP3 respirator. So when caring for patients with suspected or confirmed COVID-19, all healthcare workers need to, prior to any patient interaction, assess the infectious risk posed themselves and wear the appropriate personal protective equipment to minimise the risk. So on entering a clinical setting and entering the hospital building, a fluid-resistant surgical face mask should be worn at all times throughout the hospital. If your patient is undergoing an AGP or that you're carrying out an AGP, then you will make that step up to your FFP3 respirator. So we also have a visual guide to safe PPE. So this is just sort of demonstrating the general contact with possible or confirmed COVID-19 cases, but we do wear this for all patient contact. So that is your eye protection, that's worn on an individual risk assessment, your fluid-resistant surgical face mask, a disposable apron and gloves. And on the other side is our AGP PPE, which again is your eye protection, your eye shield, goggles or visor, your filtering face piece respirator, a long sleeve fluid repellent gown, and your gloves. So you should clean your hands before and after patient contact and after removing some or all of your PPE. Clean all of the equipment that you are using according to local policies. Use the appropriate PPE for the situation you are working in. So either your general PPE or your AGPs if you're in high risk areas or performing an AGP, and take off your PPE safely. Take breaks and hydrate yourself regularly. Cleaning of equipment. So reusable equipment should be avoided if possible. It should be decontaminated according to the manufacturer's instructions prior to removal from the patient's room. Patient care equipment should be cleaned in accordance with the manufacturer's instructions and where possible with chlorine-based disinfectant or 70% alcohol. Items that cannot be decontaminated should be disposed of as clinical waste. So staff uniform and safety at home. So personal hygiene, so just make sure that you wash your hands and forearms before leaving the clinical area. Wash your hands again when you arrive at home. Viruses easily removed by soap and water and alcohol gel. Personal items do not need to be contaminated. These are not in contact with respiratory secretions from patients. To protect yourself from contamination during the day, you should wear a plastic apron over your uniform. Doctors usually wear scrubs, and these are recommended for staff that don't have a uniform. You must change out of the uniform or scrubs before leaving the clinical area. These must be disposed of in a red alginate bag into a white laundry bag, and they are then returned to the laundry service for reprocessing. If you are issued with your own personal set of scrubs that are not from the laundry reprocessing site, you must transport these in a plastic bag. Wash these scrubs as usual in the washing machine and avoid overloading, and they should be washed separately to any other items of laundry. At all times throughout the clinical settings, you should be there below the elbow. This includes no wristwatches, fitness trackers, hand or wrist jewellery, no diamond rings. Your hair is to be tied up off your collar and only wearing one pair of studs in accordance with the workwear policy. Staff with COVID-19, if you develop symptoms, then do not come into work. Symptoms include acute onset of fever more than 37.8 degrees Celsius, loss of taste or smell, and a new persistent cough. Inform your manager and occupational health. Self-isolate at home for 7 days from onset of symptoms. Occupational health will then arrange testing. If your symptoms worsen, contact NHS 111. Staff at high risk of complications from COVID-19 should have an individualised risk assessment to manage their deployment within the trust. The e-discharge summary that should be completed on the patient's discharge summary. So there's a table below has been added to the e-discharge summary to support the communication of COVID-19 status. Failure to provide information to GPs and other primary social care providers on COVID-19 status in order that appropriate infection control measures can be implemented could result in further transmission of infection and local outbreaks of the disease. So this box you can just delete as applicable. So this is really important that it's not missed. It's quite simple to use, and you just need to record the temperature on discharge. COVID-19 screening process. Screening process includes the following. Admission screening for COVID-19 is required for all patients. Pre-admission screening for elective cases within 72 hours of admission. Screening 48 hours after admission if the patient's admission screen was negative and the patient remains symptomatic. Day 5 admission screening to be completed on all patients who tested negative on admission. Screening at any time during the admission episode if the patient then becomes symptomatic, with infection control precautions including isolation implemented. And discharge screening where patients are being discharged to a care home, domiciliary care, or there is a concern about household contacts who are shielding. We should all be informed, be prepared, be smart, be safe, and be ready to fight COVID-19. For the latest health advice, you can go to www.who.int/COVID-19. Safe handling of sharps. To reduce your risk of needle stick injury by following the safe practice, do not overfill sharps containers, do not resheath needles, use safe blood sampling system, not a syringe and needle. So most of our devices that we use are needle free or needle safe and they have a cover for easy use. Preventing sharps injuries, we have a legal responsibility to prevent sharp injuries. The user of a sharp is legally and professionally accountable for its safe disposal. If you've used it, you've been it. Below are the list of notifiable diseases to Public Health England. This can be found on Lorenzo. Although COVID-19 is on the list, we are not currently notifying individual cases. If an outbreak is suspected, then the infection control team will inform Public Health England for further guidance. The notification form to Public Health England can be found within Lorenzo or in the communicable disease policy. This needs to be printed off and faxed to Public Health England on the number listed below. If you search for a notification of diseases on Lorenzo, the form will generate and populate your patient's details, and you can just add to it what you need, print it off and fax it over. Thank you for listening. Good luck.